When Shelley Poirier's father first went to the hospital with a heart attack in May of 2023, she would have never imagined it would take over a year for him to leave his hospital bed for one available in long-term care.
We watched his mental health decline too, right? He started to get, quite depressed. And after such a long wait, he started to believe it was never going to happen.
Horizon Health says over 650 patients are taking up beds in their hospitals waiting for somewhere to go, half of which could go immediately to long-term care if the beds were available.
This number is occurring in July, when we would typically see numbers peak more traditionally during the fall period. Therefore, in order to prepare adequately for bed availability during a flu season, for example, we needed to act now.
Social Development has granted the health agency's request for critical state admission prioritization status over the next 30 days for its 4 regional hospitals. The move will bump those waiting in hospital to the top of the LTC bed list.
We will do all we can to support this process and moving forward as quickly as we can in the areas that we've identified. And the folks in community, we will do all we can to make sure that you're getting the support and the services that you need.
The goal is to move at least 20 patients out of both the St. John and Fredericton hospitals over the next month, and a few less in Miramichi in the Upper River Valley. That would still leave hundreds at the regionals, but officials say there just aren't enough long-term care beds available. Late last year, Nova Scotia Health converted a hotel into a facility for folks who no longer need acute care but still don't have a place to go. New Brunswick's nursing union isn't convinced that's the right avenue.
It's really difficult to come up with an answer that's going to solve every problem, especially when we're in a crisis. But obviously involving the input from the frontline staff, multiple stakeholders in all of those different departments, I think will go a long way.
Horizon says about 40% of their acute care beds are taken by people who have no medical reason to stay at the hospital. Ava McRae, CTV News, St. John.